Welcome to Music and Medicine on Monday, a collaboration between the College of Medicine and the School of Music here at the University of Iowa. This production is designed to help musicians play and to stay healthy. This video is supplemented with more written detail through our free medical website termed the Iowa Protocols that can be identified by Googling for Iowa Protocols Music and Medicine on Monday. We're coming to you from the recital hall in the beautiful Voxman building in the University of Iowa School of Music here in Iowa City. My name is Harry Hoffman, and I'm a physician at the University of Iowa, and it's my pleasure to introduce our featured performer today, Won-Young Kim, a doctoral student obtaining her DMA in piano at the University of Iowa. Our other guests today include Tammy Walker, the director of the University of Iowa School of Music, an accomplished performer, professor of piano, and Won-Young's mentor. Hanna Zembruska is a clinically active psychiatrist here at the University of Iowa. And I'd like to introduce Heather O'Donnell, who is an internationally recognized expert psychologist and artistic systemic therapist. We'll have to have a definition of that in the course of our discussion. She's zooming in remotely from her office in Cologne, Germany. And Won-Young, can you describe a little bit about the piece? And Tammy, you might interject a little bit about how it's playing a part in her graduating this year.
The first piece that I'm going to play is Histoire from Suite Romantique by composer Youngja Lee. She's legendary living female composer.
Tammy, can you comment on the process of getting a DMA and the work that Won-Young is doing with this particular work?
Yeah, absolutely. So it's a multi-year journey that started when she was quite young, as she discussed. What's unique about her current project is that this is a living female Korean composer. She's had the opportunity to actually interview the composer once and has a second interview coming up later this year. Very special in that this music has not been recorded before. So she will be working on a recording here at the University of Iowa of repertoire that's currently not available for people to listen to. So it's a very exciting process to be a part of, and I'm very excited for her to see how this is going to aid in her career.
So we're very fortunate to have the first recording, actually, essentially, with this production that we're putting on here today. Terrific. I'm looking forward to hearing it.
Thank you.
Won-Young, that was terrific. Really enjoyed listening and watching you perform.
Thank you.
Tammy, do you want to make some comments on Won-Young's performance and maybe in the context of our topic of performance anxiety?
Yeah, I would be happy to. I second that. Congratulations, that was really lovely. And again, very excited about your DMA project that you're working on with that repertoire. One thing I would like to mention in the context of this particular discussion is the level of anxiety that can be had by a performer when you're playing with your music versus without your music. And as you noticed, she did perform by memory. Maybe you could talk a little bit about that, how you feel differently when you have the score in front of you versus when you're just playing by memory, because they're very different sensations. Yeah.
Yeah, that is a great topic. I try to really focus on my performance, but I was really anxious. So I was really worried about my memory slip. Yeah, so with the score, actually, I can be a little bit freer than without score, because whenever I have some anxious feeling, I can just see the score and I can follow the score in front of me. But without score, I have no way to grab. So it was really challenging for me to memorize this piece in a short period of time and present for these important meetings and discussions. And yeah, that was obviously different.
Is there an advantage to doing it without a score?
Without score, actually, that has pros and cons. So if I focus on positive things, actually, without score, I can deep into the music more than reading music. So I can express more and I can feel the music effectively. So I prefer to have play some things without score, but sometimes atonal music, like a contemporary music, sometimes that needs some score, which is like a performance practice in classical area. So in that case, I can use the score.
So you mentioned some anxiety for this performance.
Yes.
We are going to speak primarily about non-medical therapy initially. How have you overcome on your own the anxiety that I know everybody experiences and that you mentioned that you had when you were younger too?
Yes, even now, even today's performance. To overcome the symptoms that I have, usually I really try to have a good preparation for the performance. That is the first step. And when I perform, I try to breathe deeply and try to have mindfulness and even a self-talking positively to me, like I can do this, I already prepared everything, something like that. So they can boost my confidence and I can be a little bit freer. So that's what I'm using. Also, I used medical help. Yeah, and on one of the days I tried the propranolol tablet and I was not sure that was that helpful for me, but at least a non-medical purpose, treatment, was really helpful for me.
Well, this is terrific to join Heather O'Donnell in Cologne, Germany, who's Zooming in with us. She's internationally known as a psychologist who has a program called The Green Room that is not only in Cologne, but also online. And Heather, do you want to take it from here and make some comments about the performance and then tell us more about the non-medical therapy?
I would love to. Thank you so much, Harry, for inviting me and also for putting this out there in the world. It's so important. And I just want to express my gratitude also for Won Kyung for putting herself in this position to be showing so clearly the difficulties that so many musicians face and don't speak about. So I'm not only really impressed by Won Kyung's playing, which is beautiful, but also by her bravery of speaking about these very, very common issues. Thank you, Won Kyung. I want to talk about confronting the beast. A couple of years ago, I wrote an article for Interlude magazine, and it was called Confronting the Beast. And so when I talk about the beast is musicians' performance anxiety. And I wrote this article from the perspective of a psychologist, but also I was a pianist, a professional concert pianist for 15 years. So I wrote from both of these perspectives. And it's really difficult. I'll just say it right out. It's difficult to generalize because music performance anxiety, the beast, affects everyone in a different way. And it's a shape shifter. In each situation, it can feel differently. So as I mentioned, so many musicians carry it in solitude and they just don't speak about it openly. And it's much, much more common than we're aware of. And this musician's performance anxiety, it's rooted perhaps in different areas. It can be rooted in childhood experiences, childhood messages about being seen as not good enough, perpetually not good enough. It can be rooted in systemic pressures. Like we always say in the music business, you're only as good as your last performance, which is just not helpful at all. And it's got a hint of this kind of evolutionary primal response of the fight, flight, freeze, fawn instincts that we all carry in ourselves in very, very extreme situations. So in the article, I really kind of pushed back against the language of, defeating anxiety and maybe even overcoming anxiety. I would advocate for a different kind of language about it. I would advocate for meeting it, for maybe befriending it, and maybe even taming it. So this beast, in my way of thinking of it, it's a little bit like Carl Jung's shadow side. And Carl Jung said, everyone carries a shadow, and the less it is embodied in the individual's conscious life, the blacker and denser it is. So I invite everybody to just bring out their curiosity, and it's not really so necessary to suppress the anxiety, but to have a lot of curiosity about what this anxiety is trying to tell us. In therapy, we use this curiosity to unfold it on an individual level. In gatherings like this, it's so great that we can do it collectively because this creates a lot of awareness about the situation. And I divide the methods on how you can approach musicians' performance anxiety in 4 different categories. One is cognitive awareness and reframing. So this means kind of befriending, personifying the anxiety, understanding it, dialoguing with it, discovering what maybe its protective role might be. The second one is a somatic approach, somatic resources. So that could be grounding in the body, working with the nervous system regulation, and using somatic approaches. The third one could be musical preparation, using techniques like audiation, that's practicing not at the instrument, but practicing in your mind, which is a common technique that musicians use. Visualization, improvisation. A lot of classical musicians don't have improvisatory skills. We lost that about 150 years ago. And improvisation can really help to take the pressure off the kind of perfection model. And then the last one is pharmacological strategies, which we'll talk about later. So I advocate across all of these domains, as I mentioned, a kind of curiosity, an investigative approach. And I prefer this rather than exile or shame. I always remind people struggling with this that they're not alone. Greats like Clara Schumann and Pablo Casals also suffered deeply from the beast. And I just want to step very briefly into kind of 3 therapeutic lenses that one could use. So I'm a psychologist, an artistic systemic therapist. When you train to be a psychologist nowadays, you train in a certain modality, but anybody who works in this field knows that you can't use a one-size-fits-all approach. So you have to go through different approaches, and you have to know a lot about different approaches in order to use the one that fits the given situation. And I just want to draw out 3 possibilities. And the first one is, my area, systemic therapy. And this could be contextualizing the beast. So I want to make it clear, this beast doesn't come out of nowhere. It's not an individual pathology, and it's certainly not an individual flaw. It really has a relational expression, and it reflects the culture that musicians are stewed in. It's kind of a survival response that's crafted by systems of families, systems of teachers, systems of conservatories, systems of the institutions that shape a musician's visibility, worth, and belonging. And with systemic therapy, we're always asking questions like, whose voice is actually this beast echoing? Could it be implicit childhood expectations? Could it be teacher-student dynamics? Could it be the music cultural myths around perfection? So these are some of the things we question. We use circular questioning, getting other people into the room, even if they're not there, like old teachers maybe, or parents, and asking them questions. seeing what they have to say about this situation. The second one I'd like to mention is ACT, and ACT stands for Acceptance and Commitment Therapy, and this could be described as befriending the beast from within. And we see that this teaches us that like the real problem isn't the anxiety itself necessarily, but it's the struggle to avoid it. So Harry was mentioning something about mindfulness before, and this is kind of where mindfulness comes in, because so much of the struggle and suffering from musicians' performance anxiety comes from the struggle to avoid it. So with ACT therapies, we invite musicians to stop fighting the internal experience and start responding to it with awareness and compassion and alignment with values, alignment with what matters. With ACT, we work on noticing the anxious thoughts without getting entangled in them. So you can notice that I'm having a thought, but I'm not the thought itself. It's just that I'm having this thought. We accept body sensations without judgment, and we reconnect with the why behind each of the performances. And this is values like connection, artistry, and expression. And there are 6 core processes in ACT, and I'll just mention them. It's kind of a process, a linear process of going from present moment awareness, mindfulness, understanding what's going on, acceptance of what's happening, then diffusion. I have a little visual aid here. This is something I use a lot with my clients. So when you're in the middle of performance anxiety, it feels like this. And what we want to do is go like this, create a little bit more room. I have some help from my Hoberman sphere here. That's diffusion. And then the other processes are the self as context, identifying the values that we're working for, that we're living for, and then committed action. So it's really going between acceptance and then identifying what the actions are that can be changed. The third one I want to mention is trauma-informed therapy. And this may seem like a very strong word, but in my experience with musician clients, there is a lot of complex relational trauma going on. And in this way, when we talk about meeting or befriending the beast, it may not be enough because the beast may not be even metaphorical anymore. It might be so entrenched in the body that it becomes part of the body. In this case, we use some trauma-informed therapy, and we understand that the performance can really trigger survival responses. We know that the survival responses are fight, flight, freeze, or fawn. And it's really not, I want to stress this, it's really not because the musician is weak or irrational. It's because their nervous system has encoded performance as a kind of threat. So this is something that we can't really handle with mindset, just thinking different or just, having different thoughts in our mind, but it's a really physiological and somatic memory. In this case, our work deals with tracking and regulating what the body's up to, what the body's saying. So this could be the racing heart, the trembling hands, the dissociation, the lack of feeling. It can be identifying protective and vulnerable parts. I'm using language from internal family systems, which is a modern approach to trauma therapy. And it's identifying the inner critics, for example, the ashamed child, the high achieving protector. And then we reprocess moments of humiliation, abandonment, or shame. And these are often tied to auditions, to big concerts, to messages from teachers and family. And then we can create a reparative relational space where the nervous system can learn it's safe to be here. It's safe to be on the stage. It doesn't always mean that it feels great to be on the stage, that it feels comfy to be on the stage. We may not need that, but we just need to know that we're basically safe. And that's what we're working towards. So these are like the things that, just as an example, there's probably 100 more modalities one could use, but just when thinking about what can one do, these are 3 modalities that I've used in my practice. And I just want to end it with this beast doesn't need to be exiled. This beast is part of the process of playing before people. Very often it needs not exile, but an invitation to speak and an invitation to be understood. And when we listen to it with curiosity, this beast may stop roaring and he might become our friend.
Great, that was terrific. Well, I know we all probably have lots of questions. If I'd like to ask the first is that when do you need to see a psychologist? You know, the sports psychologists have really been all throughout the field to optimize performance. Tammy, I think you spoke about The Inner Game as a book that musicians use that was initially written for tennis, I believe. And so what proportion of musicians need to see you, Heather?
Well, I'm not going to speak about me because this is going to sound very self-serving. All of them. I'm saying this, it's a little pointed, I understand, but it would be great if some psychological principles are embedded in the conservatory systems. And really, it's not me, it's if the first line is the pedagogues, the teachers. These are the people who are doing psychological work, and they can be doing psychologically helpful work, or they can be doing psychologically damaging work. And if teachers, professors, pedagogues are really informed about what's possible, and we can learn so much from sports psychology, there's so much less work that I would have to do, because I'm very often seeing people who have already suffered a lot and who are coming for repair or restoration. And if we can engage in other levels, it would be just so much better for everyone. I think it would be better for our system of music making. It would be better for our beloved sector. So I would like to advocate for as many psychological inputs, amplifying into like pedagogical models and throughout the whole layer of our sector.
So Tammy, is that part of your teaching, and do you call on psychologists sometimes when it's extended past your capacity?
Oh, I completely agree that every single musician could use some help in this area. And again, I so appreciated the comment about it not being a sign of weakness. From my perspective, I see it as a sign of commitment, in that musicians are very similar to athletes in that their amount of training that takes place often starts when people are young. Just from a physiological perspective, musical training starting at a young age is very advantageous. It's very difficult to become a concert pianist, if not impossible, if you start lessons at age 25, for example. I mean, there is a real kinesthetic component to all of this. So I say all that because the stakes are so high, and you often get just one shot. When you're on a stage, you have been preparing your whole life in some cases for that moment, and it's a one-shot deal. So finding ways, as you mentioned, to tap into that extra energy, we call it. We use that word instead of anxiety. To really optimize the performance, that's the ultimate goal. Just like an athlete, when they have that extra level of excitement, aka adrenaline, that's when they break the world records, for example, when it means the most. So we're constantly trying to do that. It's been really helpful in the field that it has become a little bit more universal in that there's some published materials that are out there. I do have a book behind me here that I don't know if we can zoom in on this or not, but this is one book that has certainly changed a lot of the conversations in the piano world. And there are some sections in here on performance anxiety. Phyllis Lehrer wrote a wonderful essay in here, Gail Berenson as well. And I have actually copied a section of the article by Gail Benson from this book and given it to students before performances. And it is a guided imagery, basically talking through what a day of a performance looks like. And I think that can be very helpful. I've certainly read it myself before performances as well. Just as Won Kyung was talking about, trying to be in that positive mind space as much as possible. Yeah.
So Hannah, as a psychiatrist, I'm sometimes confused as to what relative role a mentor versus a psychologist versus a psychiatrist could play. Could you elaborate on that?
Yeah, I think it might help to differentiate the training between a psychologist and a psychiatrist, because I think oftentimes even other medical doctors may be confused. So a psychiatrist is a doctor. They go through medical school just like a ear, nose, and throat doctor does. And then they do a residency in psychiatry, and you can be a child psychiatrist and adult psychiatrist. And some psychiatrists do practice therapy, but most psychiatrists do not. Most psychiatrists are prescribing various pharmacologic interventions for disorders that are found in the DSM. And I think, Heather, maybe you could explain how is the training for a psychologist different than a psychiatrist, because a psychologist does not go into medical school.
So I can say a couple words about that. As a psychologist in my bachelor, I was doing a lot of experimental research-based programs, so learning a lot of statistics and experimental design. And then at the master's levels, you could decide whether you wanted to go onto a research level or a clinical level. And so if you wanted to go towards being a therapist, you were doing clinical work in your master's level, and then you get a therapeutic training on top of that. So it's very, very, from the master's level on, it's very therapy focused.
Yeah, and I think in certain states, I'm not sure about countries, psychologists can prescribe medications, but it's not as common as psychologists providing different types of therapies in a clinical realm.
So as part of our program here across the past year and a half, we've asked a number of student performers about performance anxiety. And I'd like to interject one, a music therapist who came here from Korea to pursue a career as an opera singer.
Thank you so much for having me this afternoon. My name is Sunju Lee. I am a PhD candidate in music therapy at the University of Iowa. I originally came from South Korea to study voice at Arizona State University. During my first year as a voice graduate student, I struggled with performance anxiety, which led me to experience some back pain and digestive problems. This kind of experience was not quite pleasant. Then I decided to go back to Korea without completing the program. Then I talked to my mom, and then she was asking me, why don't you find some ways to be more proactive to manage your symptoms? And why don't you take a music therapy class, hoping that you can find some strategies to manage your symptoms? At the time, I was a pretty good daughter, and I listened to her. The decision that I made to take a music therapy class has been totally changed my whole life. Learning music therapy gave me a chance to see music as not a source of fear or pressure, but as an healing agent that can foster healing harmony inside of myself. Then I really wanted to become a music therapist so that I can share this positive experience with someone who are in need. As a performer, as a singer, I always wanted to be perfect. But learning music therapy helped me realize making music, enjoying music is not showing myself as a master of singing. It is all about enjoying the process so that I can grow with that experience. And learning music therapy helped me to come up with the strategies to understand my mind and the connection between mind and body so that I can practice and enjoy my singing in a better ways so that I can feel the moment that I am enjoying as a singer.
Hannah, do you want to talk a little bit about somatization? And I suspect you've seen a fair bit of that in your career.
Yes. It's really hard to parse out sometimes, what is in your head and what is actually in your body. They really are connected. There's a strong interplay between the two. And with somatization, oftentimes the individual is just feeling the physical effects of whatever they are, cognitively and physically experiencing from, say, an anxiety disorder. Anxiety has a lot of physical manifestations, the butterflies in your stomach, the tremor, the sweaty hands, nausea, rushing to go to the bathroom, feeling like you're going to pass out. Anxiety has a lot of physical manifestations. And, Heather was discussing some of the ways to treat that. And pharmacological options also treat the somatic symptoms too.
Well, we are talking as if we're assuming that this anxiety is occurring in otherwise perfectly normal people. So that's part of your job, isn't it? And maybe Heather's as well, identifying underlying psychiatric or other disorders that could be contributing to the anxiety rather than just performance anxiety. Perhaps there's some agoraphobia.
Yeah. So sometimes an individual with music performance anxiety only has music performance anxiety. It's really related to that. But other times, an individual might also have a social anxiety disorder. And in the DSM, the book that psychiatrists and psychologists kind of reference when looking for the specific criteria for a disorder, performance anxiety, stage fright, musical performance anxiety is a subtype of social anxiety. And social anxiety has to do with a fear of being observed. If it's okay, I can go over, the DSM is very good about kind of parsing things out. So
And what does DSM stand for?
DSM stands for the Diagnostic Statistical Manual of Mental Disorders.
And I understand it's up to the 5th edition, and that's the Bible for you all?
5th TR, yes. So social anxiety disorder, you have a marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. And the person who has this fears that he or she will act in a way or show anxiety symptoms that will be negatively evaluated. You'll be judged in a negative way. And so then, of course, you'd want to avoid the social situation. And if you can't avoid it, then you endure it with intense fear or anxiety. And the level of the fear that you have for that specific situation is out of proportion to the actual threat. If you're playing a performance piece on a stage, there really is no threat. There's no bear that is going to eat you right there. So your fear is out of proportion to the actual threat. And with disorders in the DSM, something has to be, longer than 6 months, and it really has to be negatively affecting your life. You have a difficulty in performing, or you're thinking about dropping out of your program. It's negatively impacting your relationships with your friends or your spouse or something like that. Music performance anxiety is a subtype of that social anxiety disorder. And like I said, someone might have social anxiety and music performance anxiety. They may also struggle with depression or maybe a substance use disorder that they are struggling with because that is how they are treating that anxiety or that performance anxiety.
So that's great. And so, Heather, you talked about there's really no single set of tips or tricks that you can give, and it sounds like you have to take a deep dive and establish a relationship and explore the individual problems. One trick you did describe, which I thought was great, was for the classically trained pianist to be more of a jazz type player and think about improvisation. As a guitarist who plays some jazz, I was taught there's no wrong note. If you hit the note nobody's expecting, hit it again. Make it sound like you really meant to hit that note. And is that what you're talking about, Heather, is the improvisation to make something real instead of just perfect?
Well, we've strayed so far away from the composer-performers of the 18th and 19th century. And there's a wonderful story of Franz Liszt that he was playing in a concert and he did a wonderful run up and he landed squarely on a wrong note. And there's a little devilish smile on his face at that moment. And he used that wrong note to start an improvisation. And it was delightful and beautiful and astounding. And it was a beautiful artistic moment. And we're so far as a culture away from that kind of vibrancy of musical performance. And it's really, I think, to the detriment of our art form. So this is really a systemic thing. I think on an individual level, it would be great for all musicians to understand how to get from one key to another, like one key area to another key area, so that if you're a little bit confused in the performance, you can just tap in a couple notes and then get your bearings and then continue onwards. But I think it also speaks to kind of systemic values in the culture of music making, which say, no, every single note that Beethoven wrote on the score is having to be like shown perfectly because it has to be exactly like it is on the recording. So it's puts a lot of pressure on performers.
I think imperfections are going to make a comeback. And I predict that in part because of AI. I don't know if you have heard of the band called the Velvet Shadow. It's made a big hit, and it doesn't exist. It's purely AI, and they've had some songs out that are really doing well. And so if something's too perfect, right off the bat, now you're going to start thinking maybe it's AI. So as someone who likes live performances, it's the warts and the wrinkles and the errors that really make it worth going to rather than just listening to it pre-recorded. That's my preference. Tammy, what are your thoughts?
Oh, absolutely. Yeah, there's no such thing as a perfect performance. And we say all the time, mistakes are going to happen. That doesn't matter. It's what you do after that. And I will say we teach very differently in helping students prepare for performances that are by memory versus not by memory. We have a number of strategies we use exclusively for teaching memorization that is completely different than preparing for a concert with the score. And a lot of that is based on what we're discussing now. How are you going to handle the inevitable? When something happens you don't expect and you have nothing on the stage to help you, AKA music, to help you.
So this is a wonderful opportunity to have a psychiatrist and a psychologist. Do you have questions at all for Hannah and Heather that you'd like to address?
So we are talking about perfectionism, and we previously talked about like cultural things, and you mentioned the Koreans. So as a Korean, like I grew up in the really competitive society, and probably I was affected by a lot of pressures, by a lot of things, the schools, not my parents. They were really generous and kind. Yeah, but school and like a social pressure and like some expectations about students. So probably I may have perfectionism, yeah, but how can I break this perfectionism?
So Tammy's working on breaking you of perfectionism?
I think so. She's really great at that. She always encouraged me to like perform just naturally and just enjoy the performance. That's her guidance. And sometimes I can't enjoy the performance by myself because of too much pressure. Probably that is related to my performance anxiety. But I'm trying to use many ways to break the perfectionism by myself, not only musician, but also as a person. But how can I approach this really important concept?
Well, it sounds like you've got some help if you want to reach out for it. Well, thank you, Won Young, Tammy, Hannah, and Heather, for a great performance and discussion. Additional detail regarding this and other episodes of Music and Medicine on Monday can be accessed by visiting the Iowa protocols through the QR code displayed or our website address, or simply by searching on the web for Iowa Protocols, Music and Medicine on Monday.